Hello, my dear students. I'm Dr. Jayaprakash, the Professor of Forensic Medicine. Let me discuss on FMGE May 22 exam in FMT. Discussion on recall questions. Number 1. Totally there are about 12 questions. First question. Sexual pleasure obtained by getting hurt by opposite sex is called. One of the easiest question. Masochism, sadism, transvestism, exhibitionism. Let me discuss. Algolagnia is a general term where a person gets sexual pleasure from pain, maybe by giving pain or maybe by receiving the pain. Here, there are two terms, namely sadism and masochism. Sadism means active algolagnia, where person gets sexual pleasure from giving pain to his sexual partner. Whereas passive algolagnia, known as masochism, where person gets sexual pleasure by receiving pain from his or her sexual partner. If two people indulging in sadism and masochism together, then it is known as sadomasochism or bondage. Okay. Active algolagnia means sadism. What do you mean by transvestism? Transvestism is also known as aeonism. Strictly speaking, transvestism means wearing clothes of opposite sex. If you are a female, they wear what male wears, but generally no female can wear any type of dress, but generally it is seen in males where they wear female dress, that is known as transvestism or aeonism. But here, now psychiatrist has classified transvestism under two headings. Number 1, fetichistic transvestism, where person gets sexual pleasure by wearing clothes of opposite sex, maybe undergarments or any other garments. Whereas in dual role transvestism, there is no sexual motivation. Person just wear clothes of opposite sex to experience being in the opposite sex temporarily. That is fetichistic transvestism and dual role transvestism. Okay. 20 years old girl enjoys wearing male clothes. Wearing clothes give her feeling of more confidence, and after episode she is an absolutely normal girl. Diagnosis is dual role transvestism. Okay. Exhibitionism. Person gets sexual pleasure by exposing his private parts in public places, maybe to a particular person or when they are in a group, they just expose. And it is rarely seen in females. Okay. A person was sitting naked in the balcony facing a crowded park and getting sexual gratification. This paraphilia known as very easy question. Neet PG 21. Answer is exhibitionism. One of the following is rarely seen in females. Already know the answer, exhibitionism. Now, for FMGE they may not ask, but Neet they'll ask. Exhibition is punishable under which section of IPC? Strictly speaking, all three. 290 for public nuisance, 294 for obscene act, 509 for insulting the modesty of a female. All these three. So here the answer is all, but if at all they ask to choose only one, that all option is not there, the best answer is 294. Just remember, exhibition is a punishable under section 294 of IPC. Sexual pleasure obtained by getting hurt by opposite sex is called masochism. Okay. Second question. As per MT Pact 2021, opinion of two doctors is required for. Recently, some amendment also taken place in MT Pact at the same time. Supreme Court ruling also there. Let me discuss everything on that. Previously, as per MT Pact, MTP could have been done only up to 20 weeks. After 20 weeks, there is no purview of termination of pregnancy on any grounds. But as per MTP Act 2021, at the same time, MTP Amendment Act 2021, Amendment Rules 2021, as well as Supreme Court ruling on 29/9/2022. I am clubbing all together. I don't want you to get confused unnecessarily. Now, termination of pregnancy can be done up to 24 weeks, even more than 24 also. One female can undergo MTP, but I will tell the grounds. Up to 20 weeks, opinion of one doctor is sufficient. Opinion of one doctor. RMP means registered medical practitioner for MTP up to 20 weeks. 20 to 24 weeks, two doctors has to give their opinion that termination can be done. Okay, that is the question, answer related to the question. Let me discuss other things like ground for termination of pregnancy. Now up to 24, everything is gone. Now it can be done up to 24 weeks, but when it can be done? What are the grounds? Up to 24 weeks in case of failure of contraceptive in a woman or her partner. Previously, before this Act 2021, failure of contraceptive only in case of married woman, but now it may be married or unmarried or male or female. If failure of contraception is there, it can be a ground for termination of pregnancy. Here, Supreme Court ruling in the Act, what they said is, in case of failure of contraceptive, termination can be done only up to 20 weeks, but Supreme Court said nothing like that, nothing to do. Supreme Court said even up to 24 weeks, failure of the contraception can be a ground for termination of pregnancy. Now forget about the previous act or previous rule. Okay. Number 2, survivors of rape. Up to 24 weeks. Survivors of rape. Here, there is a Supreme Court ruling. What Supreme Court rule said is, I tell in brief, then I will show you. If the husband has sexual intercourse with his own wife without her consent forcibly, and if she becomes pregnant, Supreme Court said that it can be considered as marital rape and it can be one of the ground for termination of pregnancy. Supreme Court ruled that regardless exception of Section 375 of IPC, which exempts criminalization of marital rape. Actually, as of today, marital rape is not punishable in India. But in the clause of survivors of rape, it also includes sexual assault or rape committed on his wife. Okay. Number 3, fetal abnormality. Number 4, pregnancy as a result of incestual relationship. Number 5, in case of minors less than 18 years of age. Number 6, in case of any woman with physical disability, or in case of mentally ill woman, including who is suffering from mental retardation. Mental retardation. Okay. And number 8, marital status changes during an ongoing pregnancy. Woman is pregnant, meantime divorce takes place or husband dies, then it can act as a ground for termination of pregnancy. Okay, up to 24 weeks. Number 2, MTP can be done even after 24 weeks when substantial fetal abnormalities diagnosed by a medical board, every district medical board, which consists of a nominated representative by the state government, plus a gynecologist, a pediatrician, and a radiologist. Okay. Number 3, MTP can be done at any time, even by a single doctor, if it is immediately necessary to save the life of the pregnant woman. Okay, Saving the life of the pregnant woman is our primary motto. Okay. Now, what about consent? Consent of the husband is not required. Consent of the husband is not required. Only the woman is required. She should be more than 18 years of age, mentally normal. If the woman is less than 18 or mentally abnormal, ill, then legal guardian or the parent has to give consent. Husband's consent is not required. Remember that. As per MT Amendment Act 2021, termination of pregnancy can be done in case of contraceptive failure in anyone. Previously, it was only in married woman, now in case of anyone. In case of a married woman, the consent of the MTP is required from wife. Wife means herself. Okay. So, now we got the answer. Two doctors required 20 to 24 weeks of pregnancy. That is the best answer. Okay. Number 3. Artificial bruise can be differentiated from true bruise by which of the following? Of course, it is also a very easy question. All of you know. Vesicles will not be seen in case of true bruise. How can you see vesicles? Okay. Now, let me give a list of differentiation between artificial bruise and true bruise. Number 1, cause. Artificial bruises are maybe caused by the juice of calotropis, madar plant, or maybe marking nut. Okay. Active ingredient is bilavanol, semicarpol and bilavanol, or plumbago rosea. But whereas true bruise caused by trauma, blunt force trauma. I just show you the picture of calotropis. All of you must have seen this picture. Okay. Semicarpus anacardium, they can give as water also. Identify the previous picture also. Bilva or marking nut tree. Plumbago rosea and plumbago zelansnica. Lal chitra and chitra. One is red, another is white. Okay. Site. Artificial bruises are seen wherever the juice falls over the body, exposed parts of the body. But true bruise, anywhere, depending on the assailant, wherever he hit, there may be bruise. Color. Dark brown in case of artificial bruise, whereas true bruise, typical color change will be there. Initial red, then blue. You know that very well. Then it becomes brown, green, yellow. Color changes are there in the bruise. Okay. Shape, irregular. Just like if you pour water, irregular. Likewise, because it is a juice, irregular in shape. But true bruise, usually rounded. Rounded means not exactly circle or something, usually the shape of the causative weapon. Margins are well defined. But in case of true bruise, margins are diffuse and irregular. Diffuse and irregular. But here, margins are regular. You can see clear-cut margin. No vesicle in the margin. No vesicles in the margin. Redness and inflammation is seen in the surrounding skin. But in case of true bruise, redness and inflammation is seen at the site of the bruise. Okay. Contents. Artificial bruise contain acrid serum. For example, you see marking nut juice give vesicles. If the vesicle breaks and if the acrid serum touches any other part of the skin, there again you get one vesicle. Or if you touch it and break, vesicles may be seen even in the fingertips. Whereas in true bruise, as you know, it is extravasated blood as a result of rupture of the capillaries. Itching will be present in case of artificial bruise, but true bruise, there is no itching. Vesicles, already I told, at the fingertips you can see the vesicles, but in case of true bruise, it is absent. Chemical test will be positive for artificial bruise, whereas true bruise, negative. Okay. Now coming back to the question, artificial bruise can be differentiated from the true bruise by which of the following? Presence of vesicles. Okay. Grievous hurt is said to be there if the person is in severe bodily pain or unable to follow his ordinary pursuit for minimum how many days? One of the again simplest question. I just tell you what are the clauses. Number 1, of course, you know very well, grievous hurt defined under section 320 of Indian Penal Code. Number 1, emasculation. Person loses the power of erection of penis, maybe by cutting the penis, maybe by spinal injury or injury to the nerva aerogentis. Number 2, permanent privation of the sight of the either eye. Permanent, but it may be partial or complete. Number 3, permanent privation of the hearing of any ear. Number 4, privation of any member or joint. Member means any part of the body or any organ or tissue of the body which has got its own function. For example, even fingernail is the member. We use it for itching. Okay. Number 5, destruction or permanent impairing the powers of any member or joint. Say for example, take a knife and cut the ulnar. Permanent impairment. Number 6, permanent disfiguration of the head or face. Any injury which causes scar formation over the face or head, like abrasion, no scar; contusion, no scar; laceration, incise wound, chop wound. All these you can on the face or head you can consider as a grievous hurt. Number 7, fracture or dislocation of any bone or tooth. Here the dislocation includes subluxation also. Subluxation also comes under dislocation of this clause. Number 8, any hurt which endangers the life of the person. For example, stabbing into the abdomen endangers the life of the person. Or which causes the sufferer to be during the space of 20 days in severe bodily pain or unable to follow his ordinary pursuits. So 20 days. So as already I told you, it is one of the easiest questions. All 4 so far easy questions. Okay. Which test is used to differentiate species of a blood sample, whether sample belongs to human or animal. Previously also this question asked. Again, if you use your common sense, you can answer on the spot, answer a DNA based method, because by DNA you can say whether it is human DNA or other species DNA. Now, what about Tickman's test, Takayama's test, Barber's test, Florence test? Let me discuss on that. All these are microchemical tests. You use some agents. First 2 are for semen, another 2 for blood. Look here. Florence test and Barber's test. These 2 tests are used as presumptive test to identify semen. Presumptive test, not confirmatory test. Presumptive test to identify semen. Whereas heme crystal test, also known as Tickman's test or Takayama's hemochromogen test, both are confirmatory test for blood, whether it is blood or not. But before now, I tell you one more point. Best confirmatory test for blood is spectroscopic examination, whether recent stain or old stain, spectroscopic examination. Here, sometimes it will be very difficult to differentiate between Florence test and heme crystal test because both are rhombic crystals. In case of Florence test, if you add Florence reagent on the suspected area and examine under microscope, you get choline iodide crystals, dark brown in color. Barber's test, you can see yellow needle shaped crystals of spermine picrate. This question is very, very easy. Some 2-3 times they ask, both in FMGE as well as Neet PG. Heme crystal test, again rhombic crystals, but they say it is yellowish red to brownish black. Very difficult, you have to visualize this. Okay. Like feather, pink feathery crystals seen in Takayama's hemochromogen crystal test. Nothing to worry, just before the exam, you just see the pictures, try to remember. Okay. All these I have given in my Instagram as well as even in my Telegram group, Forensic JP, Instagram, Forensic JP Online. I have given the PDF or pictures of all this. You can go through that. Okay. Which test is used to differentiate? DNA based method. Species specific test. A substance abuser was found on roadside with pinpoint people. Which of the following should be suspected? These are the easy question. 3 poisons you have to remember which give rise to somewhat pinpoint people. Morphine, carbolic acid, that also give rise to pinpoint people. Okay. At the same time, all of you know very well, alcohol causes dilatation of the pupil, cocaine causes dilatation of the pupil, cyanide causes dilatation of the pupil. Now the question is, which is the one more which give rise to pinpoint pupil? I said 3 important poison. I already said morphine as a carbolic acid. All of you know that. Organophosphorus. I just tell you what you have to remember. Effect of poison on people. Number 1, which causes constriction of the pupil. There are many causes of constriction, but you have to remember carbolic acid, opiate means morphine, as well as organophosphorus. You have to remember. Okay. Dilatation of the pupil, you have to remember alcohol, cocaine, carbon monoxide, cyanide, datura. ACCCD. Datura, all of you know, the alcohol you must have experienced also, dilatation of the pupil. Okay. Nystagmus, 2 poisons you have to remember, alcohol and barbiturate. Nystagmus, especially alcohol, give rise to lateral nystagmus. Okay. Now, a substance abuse found on roadside, answer is morphine. Now coming to the 7th question, in an injury it is noted under microscope that hair bulbs are crushed. Again, easy question. If at all hair bulbs are crushed, it has to be caused by a blunt weapon. Okay. Of course, blunt weapon can cause abrasion also by rough surface. Okay. Incise wound, sharp, you can rule out. Stab wound, sharp pointed, sometimes even blunt pointed also may be there. But I tell you, look here, abrasion, maybe graze abrasion or scratch abrasion, nothing happens to the hair bulb because it is involvement of the only superficial layer of the skin, that is epidermis. Dermis is not involved. Okay. Lacerated wounds, as you see in the picture, it is caused by hard and blunt objects like a stone, or maybe a table, maybe a bat, maybe a wicket, maybe iron rod, whatever it is. Here what happens, as you see in the picture, margins are irregular. You see the edges are contused or abraded, and neurovascular bundles like the artery, vein and nerves, lymphatics may not get transected. That is known as neurovascular bundles running across the wound. At the same time, imagine here somebody hit me with the iron rod, then skin get caught, hair bulb get caught between the underlying skull as well as hard weapon. So what happens is, hair bulb get crushed. Okay. Incise wound, just take a sharp cutting weapon. Margins are regular, edges are not contused, just a cut. Hair bulbs will not get crushed. Chop wound caused by sharp cutting heavy weapon like an axe. Because of the heaviness, the sharp blade cuts the skin. Margins are regular, as you see here. The invaginated skin comes in contact with the side of the axe, which may be bruised, like what you see. Stab wound, take a knife, pierce. Hair bulb will not be crushed. This is also a very simple question. As I said, the injury noted under microscope that the hair bulbs were crushed, most like the injury is lacerated wound. Okay, lacerated wound. Number 8. In court of law, examination of a witness is being done to develop new and old facts and to try to weaken the evidence by showing that evidence is biased, inaccurate, inconsistent by lawyer during which of the following? Again, easy question. All the students who have taken the exam must have answered cross-examination. Let me speak on recording of evidence in a court of law. First, the same lawyer start asking the question known as chief examination or direct examination. For example, if I do post-mortem examination, I will be summoned by the court of law. I go, my lawyer, I have done post-mortem for the government lawyer, public prosecutor start asking questions, same lawyer. The idea of chief examination is to put forward all the facts what I know. Okay. Leading question should not be asked. Leading question means the question which suggests his own answer where he can answer in the form of yes or no. Leading question should not be asked. Okay. Unless the witness become hostile, that I discuss later. Afterwards, the opposite lawyer start asking the question known as cross-examination, that is by the opposite lawyer. Why? He wants to prove in the court of law that what I am telling is the lie. I don't know anything. I have not done the post-mortem only. I am biased. My evidence are inaccurate. That's his idea. His idea is to weaken the prosecution evidence. Leading question can be asked. If any new things has arisen during cross-examination, again the same lawyer may start asking question, no leading questions, unless hostile. Rarely there may be re-cross-examination if any new things have been come in between by the opposite lawyer. Leading question can be asked. Any time during the procedure, judge can ask questions, that is known as court questions. That is called court questions. In a court of law examination, witness is being done to develop a new and old fact. Of course, why to waste your time? Already I told you got the answer. It is cross-examination. Now you see all 8 questions are easy, okay? A patient died because of doctor negligence, but some other factors from the patient are also present for the reason of death. Another easiest question. Question only says, doctor negligence, patient also responsible. Both are negligent. Both are negligent. Negligence of the patient has contributed to the complication in addition to the negligence of the doctor, that is known as contributory negligence. Also known as concurrent negligence. Concurrent negligence. What is contributory negligence or concurrent negligence? Both doctor and patient are negligent. For example, I am a neurologist, a patient comes to me with history of seizures, I examine after all the investigation, I diagnose him suffering from epilepsy, then I give him prescription, diphenobarbital 30 milligram, 90 tablets, one into 30 days, and I ask him to come after 1 month. I am perfect. I told him exactly the dose at the same time. But out of my negligence, I had given a prescription like this. Diphenobarbital 30 milligram, 90 tablets. I tell him, okay, take these tablets, come after 1 month. Okay. Patient buys 90 tablets, he remembers what I said, or doctor said, go and take this tablet. He takes all 90 tablets together, suffer from barbiturate overdose poisoning, get admitted to the hospital, may die, may not die. In case of death, his wife may sue me in the court of law. If he survives, he himself will sue me in the court of law that because of my negligence, he suffered. Now I may tell in the court of law, Your Honor, as per doctoral common knowledge, I don't think anybody would take all 90 tablets at a time. It is a common sense or common knowledge. Of course, I am negligent, but at least you could have asked me the dose. That is contributory negligence. But this contributory negligence only in civil cases, not in criminal cases. It acts as a partial defense in civil cases. Say, for example, where the judge wanted to award rupees 10 lakhs as compensation, and if he thinks that the patient is also contributed to extent of 40%, then court may award 6 lakhs. Okay. Contributory negligence is defense in only civil malpractice. malpractice, civil malpractice. Re ipsa loquitur, the thing speaks for itself. The thing speaks for itself. 100% doctor is negligent. Operation on wrong patient. What the defense for the doctor? Absolutely no defense for the doctor. Or operation on the wrong limb. It's a right lower limb, doctor operated on the left lower limb. Or operation on the wrong eye. Or operation on the wrong organ. Instead of removal of the right kidney, he removes the left kidney, which is normal. Okay. Or keeping a surgical instrument in the abdominal cavity, thoracic cavity, pelvic cavity, or wherever it is. Negligence. At the same time, prescription of an overdose. A patient comes to me, this is a fever. I gave him Tabdolo, 650 milligram, 80 tablet, 4 into 5 days. After 2 days, he suffer severe hematemesis and he may die. I am negligent. The thing speaks for itself. Absolutely, there is no defense. Voluntary, non-fit injuria. Remember, in case of boxing normally after the age of 18 years, people enter into boxing. By the shot of the opponent, if the person dies, he cannot get the compensation from him because he himself consented and he knew the complication. So, if someone willingly places himself in a position where harm might result, he cannot claim against other party. For example, medically why it is important. Example, radiation burns. Almost 100% of the cases by radiation, there will be some cutaneous burns. But only thing is, you should inform your patient, look, I am supposed to give you radiation, but one of the complication burns. You have to inform. After she consents, if she suffers from this radiation burn, she cannot sue me in a court of law. That is voluntary non-fit injury. Vicarious liability or vicarious responsibility. Not the one who is negligent, some other person is held responsible to pay the compensation. Compensation means damages in a civil suit. That is very, very important. It is not in criminal case. It is only in civil cases for compensation. Only in civil case. Why? Why somebody else is held responsible? Under the principle of respondeat superior means let the master answer. Let the master answer. Let the master answer. That means employer is the master. Employer is held responsible to pay the compensation in case of employee's negligence. That is respondeat superior. Okay. For example, hospital owner is the employer. He has employed so many employees, maybe doctors, nurses, technician, security, laboratory people, sweepers, anybody. If any one of these employees does any negligent act, then employer is held responsible to pay the compensation, but not in criminal cases. In case of imprisonment, the employee himself should go behind the bars. Okay, remember that. Now, coming back to the question. A patient died because of doctor negligence, but some other factors also present. Already know the answer. I discussed about it. Ipsa loquitur, voluntary non-fit injury, respondeat superior. The answer is contributory negligence. Coming to the question number 10. A person was brought to OPD with history of snake bite 8 hours ago. Patient was noticed to be in respiratory depression with heart rate 50 per minute along with drooping of eyelids. You know very well, drooping of the eyelids is one of the earliest neurological manifestation of elapids. Elapids. In India, two common elapids are common cobra and common crate. Common cobra and common crate. I have already discussed in other papers also. Okay. Whereas in case of Russell's vipers and soft-scale viper, there is prolonged clotting time and bleeding time. Now we have come to know that drooping of eyelids means it is elapid. Maybe common cobra, maybe common crate. 10 vials of polyvalent antivenom was administered. Already polyvalent anti-snake venom has been administered. Loading dose is 10 vials, as you know. And polyvalent anti-snake venom is effective against 4 snakes, as you know: Russell's viper, saw-scale viper, common cobra, and common crane. No ventilator was available in the proposal. What is the next management? What is the next management? Again, this is one of the easy question if you use our common sense. You know why? Okay, without discussion, I can give answer. Already you know elapid. Check for blood coagulation profile. No need because it is elapid, not viper. IV hydrocortisone and injection epinephrine is given in case of anaphylaxis for polyvalent anti-snake venom normally. But already 10 vials of polyvalent anti-snake venom is given. So, answer is atropine plus neostigmine. You got the answer. Okay. Anyway, let me discuss. When the person comes to the hospital, first you have to wait and watch for the signs and symptoms. If indicated, start with polyvalent anti-snake venom with 10 vials, which is effective against common cobra, common crate, Russell viper, saw-scale viper. But polyvalent anti-snake venom produced by Hofkin Biopharmaceutical Company neutralizes venom of pit viper due to paraspecific activity. That means you can give PASV even in case of pit viper if it is prepared from Hopkins Institute. Okay. Now, one very important question. The neurotoxins in case of common cobra and common crate, fixes at the postsynaptic region in common cobra and presynaptic region in common crate. That's why all your undergraduate books say that in case of elapid snake bite or snake envenomation, you have to give neostigmine. Strictly speaking, neostigmine is indicated only in common cobra, not in common crate. Not in common crate, but it is not given in undergraduate books. Okay. But remember that. Neostigmine is indicated in case of poisoning by. This question asked in AIMS previously. If you read only undergraduate books, you will not be knowing because they have given elapids. Elapids, both A and B are elapids here. So, answer is common cobra. Be specific. Okay. See, this question is formed by looking at the only undergraduate book, and now you got the answer. The answer is elapidae. Okay. FMGE, August 2020. A man was admitted in the hospital with alleged of snake bite and showed the signs as shown in the picture below. His three friends saw him lying on the ground and they took the picture of the snake. Subsequently died. You can see drooping up eyelid. That means it is neurotoxic poison, maybe common cobra or common crate. At the same time, you can see the picture. It is not a cobra, it is a crate, common crate. All these pictures again, as I said, in my files I have given in Telegram files as well as Instagram files also I am going to update. Okay. Answer is respiratory paralysis. In neurotoxic, cause of death is respiratory failure. Okay. A person was brought in OPD. So, already I discussed no need of blood coagulation profile, but I told you the importance of neostigmine. Now, you may think why atropine? Atropine can increase the heart rate, at the same time it counteracts the muscarinic effects of neostigmine. That is why along with PASV, if you give neostigmine, along with that you give atropine. Okay. Antidote for lead poisoning is, now let me discuss on treatment for lead poisoning. Depends on whether it is mild poisoning or severe poisoning. In case of mild poisoning, you can give ideally dimercaptosuccinic acid or calcium EDTA, ethylenediamine tetracetate. In case of mild poisoning, DMSC. Actually, DMSC is not available in India. So, India give EDTA only. But if you have to select only one ideal antidote for lead poisoning, better to choose DMSC. But in case of severe poisoning with encephalopathy, The DMS or ADTA cannot cross the blood-brain barrier, but BAL can cross the blood-brain barrier. That's why you have to give BAL. You have to give BAL in addition to DMSE or calcium EDTA, which acts on the body. You understand the concept? Okay. Mild poisoning, only DMSE and EDTA. If there is signs of encephalopathy, you have to give BAL. Lead poison in children without encephalopathy. Now you see EDTA is there, DMSA is there, then best answer is DMSA. If DMSA is not there, EDTA. Okay. Which of the following chelating agents is recommended for plumbism with signs of encephalopathy? Dimercaprol means BAL. Okay. Antidote for lead poisoning is BAL plus EDTA. Deferoxamine is a good antidote for iron toxicity. Prussian blue, potassium hexacyanoferrate, is an antidote for thallium poisoning. Thallium. Penicillamine or cuprimine, especially used against copper poisoning. Okay. Identify the fracture shown below. Okay. What fracture? Here you can see, you see the inferior plate of the orbit. Below that, you can see a protrusion. Okay. What is blowout fracture? Blowout fracture means fracture of the orbital wall. Usually the inferior wall, but the orbital rim is intact. Orbital rim is intact. Fracture of the inferior wall. Okay. Which is caused by an object larger than the orbital aperture, like a cricket ball or football or any such objects. If it falls forcibly, it may give rise to blowout fracture because of the sudden increase in the intraocular pressure. Okay. Now here what happens is, the periorbital pad of fat may protrude through the fractured fragment, and on radical examination, it may give rise to a sign called teardrop sign. I have shown with the black arrow. Teardrop sign. This question maybe ENT question also, or maybe radiology question also. Okay, that is teardrop sign. Once you see the teardrop sign, that means it is blowout fracture. See here, white arrow. Now you can see that is protrusion of the periorbital pad of fat. Okay, blowout fracture is seen in orbit. Teardrop sign is seen in case of blowout fracture. Identify the fracture shown below. You can see the teardrop sign, so your answer is blowout fracture. Regarding the discussion on these 12 questions, let me discuss on FMGE December 2021 discussion on recall questions in forensic medicine and toxicology. There are 10 questions. Okay. Number 1. What type of toxin is released by the snake shown below? Which snake you see? You can see the hood. Once you see the hood, it may be king cobra or common cobra. Both are elapids. Elapids are neurotoxic. You got the answer already, neurotoxic. Let me discuss. In India, most commonly found snakes on earth are 2, elapids and vipers. One more is sea snakes, not on the earth, on the sea, in the sea. Okay. Elapids, most common is common cobra and common crate, vipers, Russell's viper and soft-scaled viper. Out of these 4 snakes, again most common is common crate. Okay. Elapids are neurotoxic, vipers are hemotoxic or vasculotoxic, sea snakes are myotoxic or musculotoxic. What is the cause of death? Cause of death will be respiratory paralysis, giving rise to respiratory failure in case of elapids. Circulatory failure in case of vasculotoxic envenomation, and musculotoxic, again it weakens the muscles of respiration, so death due to respiratory failure. respiratory field. Okay. Now, king cobra, Ophioophagus hanna. Of course, in FMG they don't ask about the scientific name normally. It is the longest snake in India comparatively. It may grow 3 to 4 meters also. It has got a hood. Okay. Somewhat black, a dark in color. Okay. Whereas common cobra also got a hood, and also you can see some 2 black spots on the ventral aspect of the body. Okay. There is a presence of hood. Backside you see there will be a spectacle mark or monocle mark. Picture 1 and 2 you can see the spectacle mark, otherwise monocle. Common cobra, scientific name is naja naja. Spectacle or monocle mark. Now we see here third supralabial mouth maxillary scales are known as supralabial scales. Mandibular or infralabial scales. You see here 1, 2, 3. Third supralabial touches both eye as well as nostril. And one of the identification feature of common cobra. Rarely they ask. Third supralabial touches both eye and nostril in common cobra. Common cobra. Common crate. Bungarus ceruleus. Common crate. How to identify common crate? Look here. Thin stripes on the body. You can see the stripes. It is thin and slender, 1 to 2 meters in length. Thin stripes. But thin stripes not necessarily should be present always. Okay. Look at the another picture. Common crate. Okay. Central row of hexagonal scales on the dorsum. On the back side of the snake, you can see central row of hexagonal scales as you see in the picture. Central row of hexagonal scales on dorsum is seen in common crate. Common crate. One more question also can be asked. Fourth infralabial is largest. You count from medial to lateral. You count from medial to lateral. 1, 2, 3, 4. Fourth infralabial is largest. There may be a question. Fourth infralabial largest in common crate. Common crate. Okay. Banded crate. Previously I said there may be thin stripes on the body, but banded crate there will be thick bands, maybe white, maybe yellow. That is banded crate. Banded crate also neurotoxic. Okay, neurotoxic. Now you see yellow bands. Russell's viper, easy to identify how it has got a triangular head with narrow neck. At the same time, all of you can see on the body, there are 3 rows of diamond shaped marks on the body. You see one central, another right and left. 3 rows of diamond shaped marks on the body. Look at this picture. Meantime, I show you one more picture. Russell's viper. Daboya, Russelli. See one more picture. 3 rows of diamond shaped marks on the body. Another picture. Okay. Saw-scaled viper. Why it is known as saw-scaled viper? You see here near the arrows between the body and belly. You can see the shape of the scale. It looks like saw, edge of the saw. Edge of the saw. So, saw-scaled viper. Okay. So, you know, you can identify this as a king cobra. Even if you identify this as a common cobra, nothing to worry. Answer is same, neurotoxin. Okay. A patient was referred by a doctor to a radiologist for CT scan. Radiologist gave commission to the doctor. It is described as, I think all of you know, dichotomy. Now let me discuss on that. Professional misconduct. Medical profession is noble profession. You have to maintain the respect of the profession. If at all, at the same time, at the time of permanent registration, the State Medical Council issue warning notice. Warning notice in the sense, a list of ethical practices as well as unethical practices, means what you are supposed to do, what you are not supposed to do, that is known as warning notice. Giving some examples, doctor should not treat a patient under the influence of alcohol or under the influence of addiction to any drugs, or he should not do criminal abortion. He can perform abortion only under the purview of Medical Termination of Pregnancy Act 2021. Association with unqualified people, or maybe association with the pharmacist, association with the laboratory technician. Along with the association, you may give commission, that is also known as dichotomy. Adultery, improper conduct, not exactly it should end up in sexual intercourse. If you take sexual advantage of a female patient or her relatives or his relatives, then it is adultery. Advertisement, repeated advertisement in the newspaper. See, once you go on leave for a long time, you can put advertisement. Once you start a practice, you can advertise. But repeatedly, if you put advertisement about your practice, that is professional misconduct. At the same time, what is covering? Covering means having relation with unqualified or uncertified persons where it enables them to practice medicine or midwifery or even to perform surgery in the name of the registered medical or resident medical officer, registered medical officer. Okay, covering. Dichotomy is fee splitting, giving or taking commission. Canvassing, keeping agents or touts to attract patients. Okay, this is an easy question. Answer is dichotomy. Dichotomy. Okay. A man was brought to the hospital with uncontrolled excessive sexual desire. Which of the following could the man suffering from? Now let me discuss on these 4 terminologies. Excessive sexual interest in males is known as satyriasis. At the same time, excessive sexual interest in females, nymphomania. Nymphomania. There is a difference between satyriasis and nymphomania. Fetishism. Fetishism. Person gets sexual pleasure by handling a particular object or clothing, like especially the undergarments, or maybe chappal, or maybe spectacles, or any article belonging to a person on whom he or she is interested, known as fetish objects, or part of the body but not the sexual organs. Any part of the body, maybe toe means, I am not showing the toe, is the thumb, finger. Other than sexual organs, person gets pleasure. That is fetish. Okay, see, this fellow is fetish towards the foot or the ankle or the leg, whatever it is. Okay. Obtain sexual gratification by the non-sexual objects belonging to the opposite sex is known as fetishism. Not only opposite sex, even same sex, if he is interested, that is also fetishism. Okay. Necrophilia, all of you know, sexual attraction to dead bodies, handling or fondling with the dead bodies, punishable under section 297 of IPC under indignity to human corpse. At the same time, person not only handling and fondling, he may even have sexual intercourse with dead body. That is necrophilia, also known as necromania. Necrophilia, necromania, both are same. Necrophagia is extreme degree of sexual paraphilia, where person eats the flesh of a corpse and gets sexual gratification. Again punishable under 297, indignity to human corpse. Indignity to human corpse. So now you know the answer. Answer is Satariasis. Okay. Identify the plant shown in the image below. Definitely it is an unexpected question. Even we never teach about this. This is if you are from village side or if you are gone towards village side, even the city also you can see, known as Parthenium. But Calotropis, cannabis, chrysanthemum. You can rule out these three. Then automatically, even if you are not seen the Parthenium, you can answer as Parthenium. You see here, chrysanthemum. All of you have seen this flower. Chrysanthemum is a flower. Calotropis. This also I think almost all of you have seen. Madar plant which give rise to madar juice. Madar juice may be used to produce artificial conjunctivitis or maybe for criminal abortion. See another two pictures of the madar plant or Calotropis. Cannabis, definitely you have seen the tree. 1, 2, 3, 4, 5, 6, 7. 7 branches are there in the leaf. Now Parthenium, I enlarge the picture. You just rule out these three. Calotropis you know, cannabis you know, chrysanthemum you know, then answer is Parthenium. Okay. It's an unexpected question. Which of the following is the true statement from the image given below? You see the image, of course, I don't think it is the exact picture what you got. We don't get the exact picture because it is only recall questions. Because say a person holding some grass or some leaf or something in the hand. Cadaveric spasm. Cadaveric spasm. One of the definite sign of antemortem drowning is cadaveric spasm with weeds or grass in the hand. Weeds or grass in the hand. Okay. If you throw a dead body into water to mislead the investigating officer, definitely there will not be cadaveric spasm with weeds or grass in the hand. Okay. But at the same time, I tell you, even in homicide and drowning also there may be cadaveric spasm. So here, a case of homicide, maybe a case of homicide. Suicide, maybe a case of suicide. Because in suicide also person may have a cadaveric spasm. But once you see grass or weeds firmly cranked, the best answer here is just cadaveric spasm. Forget about a case of homicide, a case of homicide. It could be a case of homicide, could be a case of suicide, but it is not a rigor mortis. Okay. An image is given below. Identify the order caused by it. All of you know what is this? Body is totally dried and desiccated and shriveled. Case of mummification. Remember, mummification means just like this dried wood, no smell. Unless it is sandalwood or some other, some particular smell may be emitted by some particular wood. Otherwise, it is odorless. Okay. Now, let me discuss on mummification and adipocere. Both these are modification of putrefaction. Sometimes at a particular stage of putrefaction or without putrefaction, body may go for a change called adipocere, also known as saponification or grey wax, where body fat is converted into higher fatty acids by Clostridium welshi, by the enzyme lecithinase. Or sometimes the body may be totally dried and shriveled, known as mummification. Mummification. I show you another picture. You see adipocere as well as mummification. Okay. Now, when you get adipocere, there should be moisture. There should be temperature, should be somewhat warm temperature. Relative diminution of air. Relative diminution of air. Exactly opposite condition for mummification. Absolutely no moisture, high temperature and free flow of air. Then the body may go for mummification. In case of adipocere, it may give rise to a rancid smell. Sometimes even ammoniacal smell also may be there. Mummification, totally odorless, no odor. The same question asked in AIMS exam also previously. You see here, facial features are well preserved in case of adipose, whereas in mummification, general facial features are preserved. If you know the person very well since a long time, you can try to identify in case of mummification. But adipose, when casual friends also we can identify. Okay. So answer is odorless. Identify the post-mortem finding. Exactly, I tell you, it is not exact picture. Left lung missing, fat necrosis, cardiac tamponade, pulmonary embolism. Look here, cardiac tamponade, collection of blood or fluid in the pericardial cavity, may be acute, may be chronic. Say for example, rupture of the heart give rise to acute cardiac tamponade. And many times under medical conditions, there may be chronic cardiac tamponade. Minimum amount of blood to give rise to death by acute cardiac tamponade is 200 ml. Around 200 ml. Minimum amount of blood. Okay, now I enlarge the picture. If it such pictures are given, first you should identify which part of the body. I show you with the arrow. You can see ribs are cut at the costal cartilage. Under that you can see the blood. Okay, the pericardial sac is exposed. You can see the blood clot. Cardiac tamponade. Identify cardiac tamponade. You can see the dark colored blood. Okay. Identify the test shown in the image below. I really don't understand why these people are giving us the things. Just remember, Barberio's test and Florence test are used as a presumptive test for semen. Takayama's test and Teichmann's test are confirmatory test for blood. Okay, this. Here, the answer is Teichmann's test. Let me discuss on that. I don't know, especially FMGE. Also in Neet PG, they repeatedly asked about questions regarding these Barbarios, Florence, also things. You can see the difference, but see the picture number 1 and 3. Picture is almost same. Both are rhombic crystals. Okay. Florence test and Teichmann's semen crystal test, both looks almost same, the shape wise. Where Barberio's test, you can see yellow needles. Takayama's, you can see feather like crystals. Florence test is dark brown, supposed to be dark brown. So if at all in the picture you see dark brown rhombic crystals, you can say it is Florence test. Yellow needles in case of Barber's test. Teichmann's again yellowish red to brownish black. In this particular picture, you can see the word yellowish. Even first picture also you can see yellowish. Very difficult actually. Okay. I really don't understand why they give such questions. Takayama's pink feathery crystals. Just one day before the exam, you just visualize this in your mind. Florence. Same picture only they give generally. Even in the Google, they don't give other pictures. Okay. Meantime, I have given this in my files in my Telegram group, that is Forensic JP. Instagram also I have given Forensic JP online. You can just see these pictures. Okay. Question number 9. Patient took an unknown poison and brought to hospital. Okay. On examination, there was excessive sweating, lacrimation, bradycardia. Blood pressure was 80 by 60 millimeter of mercury. What is the drug of choice? First, you have to diagnose what is the poison. Just remember, organ of phosphorus increases the secretion of all the glands in the body. Whereas morphine increases only sweating. Morphine increases only the sweating. Perspiration, excessive profuse perspiration in case of morphine poisoning. But organ phosphorus, everything, tears, nasal secretion, tracheobronchial secretion, gastrointestinal secretion, sweat, everything is increased in case of organophosphorus. Let me speak on organophosphorus. Organophosphorus poisoning is known to give rise to meiosis, but not in all 100% of the cases. Okay. There you have muscarinic effect as well as nicotinic effect. The muscarinic effect gives rise to decreased blood pressure, that is hypertension, as well as decreased heart rate, that is bradycardia. Nicotinic is opposite, hypertension and tachycardia, but muscarinic is predominant. So, overall, if you see in 100 patients, majority of the patients, muscarinic effects are more. So, they see hypertension as well as bradycardia. Hypertension, bradycardia. Okay. Popular mnemonic, sludge. Yes, salivation, sweating, increase salivation, increase sweating. L, increase lacrimation. U, increase urination. D, increase defecation. G, gastrointestinal cramping. E, emesis. Emesis. All these are seen in organophosphorus poisoning. Okay. A farmer is presented in the emergency room with pinpoint people, increased secretion and urination, likely diagnosis, organophosphate, FMGE, December 19. A farmer was brought to the casualty with pinpoint people, increased secretion, a garlic order from the breath. The ideal antidote for the poisoning is, again the same question is asked, but here they ask the antidote. Poison same. So, organophosphate is very important for FMG exam. Okay. Now, ideal antidote, it is atropine. Let me discuss on that. Now, you may think, why atropine? Why not enzymes? Actually, the role of enzyme is controversial. Atropine is the specific antidote. Remember that. I will discuss on that. What is the specific treatment for OP poisoning? Enzymes, atropine. I told you clearly, the answer should be atropine. Why? The role of enzymes are controversial. Role of enzymes is controversial. Atropine is the drug of choice. Remember that. When you should stop the atropine? Many people say when the pupils are dilated. No. Maintain the airway. Maintenance of the airway is very, very important. So, answer is when the tracheobronchial tree is cleared. When the tracheobronchial tree is cleared, we can stop injecting atropine. Atropine is contraindicated in cyanosis due to the danger of ventricular fibrillation. Remember that all these are important points I am telling you, okay. Atropine is contraindicated in case of cyanosis. You have to correct the cyanosis, then only can give atropine. Otherwise, patient may die of ventricular fibrillation. Atropine should never be started in cyanosis due to danger of ventricular fibrillation. Okay. Patient took an unknown poison. On exam, there was excessive sweating, lacrimation, bradycardia, hypotension. Organophosphorus poisoning. Treatment is atropine. Treatment is atropine. Okay. Last question. A couple did not want a girl child and aborted by using an abnormal method. Abnormal method what? Non-medical methods. This is a simple question. Non-medical methods. What? We doctors don't use the method those people have used. And also question meant a criminal abortion. Okay. Vacuum aspiration, we do in the medical college. Prostaglandins, we give in the medical college by a doctor. D&C, we do. Abortion stick. Have you seen abortion stick in a medical college? You must have seen in forensic medicine department museum. The abortion stick means what? Any stick, even bamboo stick or even sometimes calotropis indica stick or any other stick they can use. Okay, here the answer is abortion stick. Very simple question, straightforward question. But let me discuss on that. What is abortion stick? A thin wooden or bamboo stick about 15 to 20 centimeter in length and about 0.5 to 1 centimeter in diameter. Okay. Now, one end of the stick is wrapped with the cotton, maybe cloth or cotton wool. Then this is dipped into some irritating juice, what you call abortifacient agents like maybe madar juice, maybe juice of oleander, juice of plumbago or juice of marking nut, and they introduce into the uterus. Or sometimes they may prepare a paste made from arsenic oxide or arsenic sulfide, lead, etc., toxic substances. Anything, any irritating substance. Then it is passed into the uterus. Abortions take not only because of the toxic principles of abortifacient agents, abortion stick itself acts as a foreign body, and especially potential conception is especially due to uterine contraction or rupture of membrane. Membrane gets ruptured when you try to introduce through the cervix into the uterus. So, uterine contraction or rupture of membrane. So, that is regarding abortion stick.
FMGE June 2021 FMT recall session. Number 1. Gutter fracture of skull is associated with. Now, you should know what do you mean by gutter fracture. Gutter fracture, you have seen the gutter by the side of the road. It is furrow in the outer table of the skull. You see, skull is made up of, skull bone is made up of outer table, inner table and diplo in between. If you get a furrow in the outer table, then it is known as gutter fracture. Frequently, it is accompanied with comminuted depressed fracture of the inner table. How you can get a gutter? Just use your common sense. Especially when a bullet is glancing through the skull bone. Say for example, imagine somebody shoot me with a rifle or revolver or pistol. The bullet just crosses at an angle, removing only the outer table, that is known as gutter fracture. So, gutter fracture of skull is associated with bullet. Sharp object like a knife enters into the skull, then it is known as penetrating fracture. If the same knife or iron rod comes out from the other side with wound of exit, then a perforating fracture of the skull. Fall from the height may give rise to linear fracture like fissure fracture or maybe comminuted fracture, or fall from the height on buttocks or feet may give rise to even ring fracture. Okay. Cherry red colored PM lividity is associated with poisoning by. Now, let me discuss post-mortem lividity and color changes. Post-mortem lividity means staining of the skin due to blood flowing into the dependent parts of the body after death. Depending on the poison, the color may change. Like, in case of carbon monoxide, it gives rise to cherry red discoloration. Carbon monoxide, it gives rise to cherry red discoloration. Cyanide gives rise to bright red color. Bright red. Hypothermia, death due to hypothermia, and if the body is kept in refrigerator, then it gives rise to bright pink discoloration. Phosphorus, dark brown, dark brown. Nitrites and aniline, nitrites and aniline, reddish brown. But remember, sometimes it may be deep blue in color, deep blue. Suppose if in the option deep blue hypostasis is seen in case of, if both options aniline and nitrite is there, you should opt for aniline. Hydrogen sulfide gave rise to bluish green discoloration, bluish green discoloration. And in case of death due to Clostridium perfringens, septicemia, it may give rise to bronze discoloration, bronze discoloration. Okay. For example, look at this picture, you can see the post-mortem lividity, which is bright red or brick red in color, which is seen in case of cyanide poisoning, cyanide poisoning. So, cherry red colored PM lividity, of course, it is many times it is very difficult to differentiate between cherry red and brick red, bright red, also things. It is mainly theoretical, and especially in black skinned people, it is very, very difficult to look into the color changes. Okay, but here you can say cherry red is due to carbon monoxide, hydrogen sulfide it is bluish green, hydrocyanic acid it is bright red, nitrites as I already mentioned reddish brown or sometimes deep blue. But if both options are there between aniline and nitrite, deep blue should be aniline. In barbarous test, yellow needle shaped crystals are seen under microscope. This is done to detect. This question asked repeatedly, not only in FMGE, even in Neet also. They ask many times. What are the presumptive or screening test for semen? Presumptive or screening test and confirmatory or definite sign. The definite test is microscopy. If you see a sperm under microscope, then definitely can say the given liquid or stain is semen. Or detection of LDH isoenzyme is a definite proof of semen. What are the screening tests? The screening tests are like barbarous test, where you see spermine picrate as yellow needle shaped crystals. There are two tests for semen under microscope to look into the crystals. Number one, barbarous test. Spermine is secreted from the prostate and the barbar reagent forms spermine picrate in the presence of spermine and give rise to yellow needle shaped crystals. Number two, fluorescence test. Choline and lecithin is secreted by the seminal vesicle. The fluorescence reagent give rise to dark brown rhombic crystal under microscope. Okay. In barbarous test, yellow needle shaped crystals are seen under microscope. This is done to detect semen. There are so many other tests like acid phosphatase test, T30, zinc test. So many tests are there. But under microscope to look into the crystals, barbarous and fluorescence test. A person was admitted to the hospital with tachycardia, tachypnea, increased BP and scratch marks on the body. Why scratch marks? That means person was scratching. Why person should scratch in case of poisoning? Either he should be allergic. If not allergic, if you use your knowledge, you must have heard of cocaine bugs or coke bugs or Magnum symptom, which is seen in case of cocaine poisoning. Cocaine is a delirium poison. Datura, cannabis, cocaine, atropa belladonna, all these are delirium poison. And tachycardia, tachypnea, increased BP may be seen in cocaine as well as cannabis, and also in case of any other delirium poison. Even LSD there may be tachycardia, but heroin is respiratory depressant because it is somniferous poison. So you can rule out heroin. Now, scratch marks due to tactile hallucination known as formication, where person feels insects crawling over the skin or sand grains under the skin, where person may continuously scratch to get rid of these insects what he feels. So, if you go through that, here the best answer, not the best answer, the ideal answer is cocaine. An unconscious person with head injury requires emergency surgery. That means he is unconscious, requires surgery. Who should give consent? Relatives are not available. What doctor can do? Let me think about the age and consent. As per section 90 of IPC, consent is not at all valid if it is given by a child below the age of 12 years for whatever it is. So, as a doctor, if I speak, a child below the age of 12 years cannot give consent even for general physical examination. Who can give? According to 89 IPC, parent or guardian can give consent. Whereas 12 to 18, child can give consent for only general physical examination, but not for even PV and PR. Pervaginal rectal examination cannot be done. No invasive procedure, no blood test, no injection, no X-ray, nothing. More than 18 years, consent can be given for any act. Consent can be given for any act, even major surgery, as per section 87 IPC. 87 IPC. Okay. Now, consent is not required in case of emergency as per section 92 IPC. Emergency means if a child comes with severe chills and rigors, where no attendants are there, you suspect malaria, immediate treatment is required, then you can proceed with the examination and treatment. Or if the patient is incompetent due to what? If he is unconscious as asked in the question, or if a person is totally intoxicated, even if he gives consent, consent is invalid, or a mental ill person, even if he gives consent, consent given by a mental ill person is not valid. In such cases, doctor can proceed with examination, treatment, even surgery. 92 IPC act done in good faith to benefit of a person without consent. It is impossible for the person to signify consent, incapable of giving consent, done with the benefit of the patient, he can proceed with examination. But look at this question. A person presents with crush injury of both lower limbs in an emergency, refuses to consent for surgery. But many people say as per 92 IPC can proceed with examination, but you are wrong, because students just see emergency, but not the question of emergency. Here, person is conscious. Once he is conscious, if he does not give consent, he cannot proceed with examination. If he is unconscious, then only he can proceed with operation. So, here answer, doctor cannot operate on the end. But in this particular case, unconscious with the danger require emergency surgeon, such scenario, if no relatives are available, the doctor should operate without consent, because he is unconscious. 92 IPC. A farmer was brought to the casualty with pinpoint pupil, increased secretion and garlic odor from the breath. The ideal antidote for the poisoning is. What gives rise to garlic odor? Arsenic, thallium, phosphorus, organophosphorus, selenium, tellurium. These give rise to garlic odor. Which give rise to increased secretion? Organophosphorus. Organophosphorus compounds increases the secretion of all the glands. Increased secretion of the bronchial tree. There will be wheezing, mimics asthma. Increased secretion from the lacrimal glands, increased lacrimation, known as crocodile tears. Normally people cry when they are emotionally or physically hurt. Here just like that, tears coming out, so known as lacrimal crocodile tears. It is also known as, sometimes the tears may be red in color, known as chromogenic tears or chromolacriuria. Increased secretion from the kidney, increased urination, which may give rise to incontinence of urine. Incontinence of urine. Cause meiosis may be pinpoint pupil, especially organophosphorus, morphine and carbolic acid, means phenol, may give rise to pinpoint pupil. But here it is not in all the cases, remember that. Muscarinic action may give rise to hypotension and bradycardia, but nicotinic action may give rise to hypertension and tachycardia. But here predominantly muscarinic, so there will be hypotension and bradycardia. Increases all the secretion, increase salivation, increase sweating, increase lacrimation, increase urination, increase defecation, gastrointestinal cramping and emesis. The mnemonic is sludge. Sludge. What is the treatment? Many people say oximes. No. Specific antidote is atropine. Role of oximes is controversial. Since about 6 to 7 years, it has come in journal that oximes does not have any beneficial effect in case of organophosphorus poisoning, but even today all the doctors they give oximes, but specific antidote is atropine. So here even the oximes and atropine are there, your answer should be atropine. Organophosphate compound poisoning, atropine is a former organophosphate used as insecticide. Judicial hanging is a method of execution of a condemned criminal in our country. The cause of death in such cases would be. What is the cause of death? What are the causes of death in hanging? Cause of death in hanging may be asphyxia. Fatal hypoxia is when oxygen level is less than 20% of normal. Venous congestion. Venous congestion because of the constriction of the jugular veins. It will give rise to venous congestion, which give rise to cerebral apoplexy. Cerebral apoplexy. Combined asphyxia and venous congestion. Because of lack of blood supply to the brain, cerebral ischemia or cerebral anoxia, maybe reflex vagal inhibition, or maybe fracture or fracture dislocation of cervical vertebrae. When it is seen, fracture or fracture dislocation of cervical vertebrae normally seen when there is hanging with a drop, like judicial hanging. Out of all these, most common cause of death is combined asphyxia and venous congestion, but in case of hanging with a drop or judicial hanging, cause of death will be fracture, dislocation of cervical vertebrae with underlying transection or disruption of the spinal cord. And in case of judicial hanging, you get usually fracture of C2 or sometimes C3. That is known as hangman's fracture. Hangman's fracture, fracture C2 or C2 at C3. Do you hang a method of execution of condemned criminal in our country? The answer is fracture, dislocation of cervical vertebrae. A 35 years old person comes to the casualty with a history of consumption of some unknown seeds. On examination, there are dilated people, dry mouth, decreased secretion. Just opposite to the previous question where they ask about organophosphorus. Exactly opposite to the organophosphorus is datura. Datura fruit known as thorn apple, the seeds which contain hyoscine, hyoscyamine and traces of atropine. That's why it gave rise to dilated people. Suppresses the secretion of all the glands, right from lacrimation, sweating, bronchial secretion, urine, gastrointestinal secretion, everything is suppressed. That's why they say very dilated people, dryness of the mouth, dryness of the throat, difficulty in talking, difficulty in drinking, difficulty in eating, dysphagia, same thing, dilatation of cutaneous blood vessels, dry, hot skin, disorientation, delirium, death, all this. So here there was dilated people, dry mouth and decreased secretion. The suspected poisoning is datura. The antidote is physostigmine or neostigmine or pilocarpine. Okay. Which is the first tooth to appear? There are two sets of teeth, permanent and temporary. Temporary teeth are also known as deciduous teeth or primary teeth or milky teeth. Number 2, permanent or secondary teeth. The temporary. From medial to lateral, there are only 5 teeth in each quadrant. Central incisor, lateral incisor, canine, first molar, second molar. There are no premolar or bicuspid teeth in temporary. Okay. So total number of teeth are 5 in each quadrant. That means total number of teeth in a child, primary teeth are 20. Total number of teeth are 20. Which is the first tooth to erupt? Remember this picture. First tooth to erupt in life is lower central incisor at 6 to 8 months. Then comes upper central incisor at 7 to 9 months. Upper lateral incisor 7 to 9 months. Lower lateral incisor 10 to 12 months. That means 1-year-old child will have 2 into 4, 8 teeth. 8 teeth. A 1-year child will have 8 teeth. Okay. Then comes the first molar, 12 to 14 months. Canine, 17 to 18 months. 1.5 years child will have 16 teeth. Already we mentioned 8, then 4 first molar, 4 canine, total is 16. So 1.5 year child will have 16 teeth. 16 teeth. Second molar appears at 20 to 30 months. That is the last teeth to erupt in a child. So a 1.5 year old child roughly will have, maybe earlier also, 20 teeth. One of the following temporary tooth erupt earlier in upper jaw than its counterpart. See, as a rule, teeth erupt earlier in lower jaw, but exception, as I mentioned already, is lateral incisor. Lower lateral incisor 10 to 12 months, upper lateral incisor 7 to 9 months. Okay. Which is the first temporary tooth to erupt? Lower central incisor. Now, permanent teeth, as all of you know, central incisor, lateral incisor, canine, first bicuspid or premolar, second bicuspid or premolar, first molar, second molar, third molar. 8 teeth in each quadrant. Total number of teeth are 32. Okay. Here, how to remember? Eruption. The order of eruption is like first molar, central incisor, lateral incisor, first bicuspid, second bicuspid, canine, second molar, third molar. You can remember with the mnemonic MIIB, BCMM. You can remember, mummy is in bed, baby cries, milk. 6, 7, 8, 9, 10, 11, 12, 18 to 25. This is as per Dr. Anil Agarwal's textbook. So, first permanent tooth to erupt is first molar, last is third molar. Okay. So, best method to determination of the age up to 12 years is by dentition. So, first tooth to appear is lower central incisor. A person who has committed a crime has been brought before the court of law by the police. The court may direct the police to take him to the juvenile court if his age is. A simple question, only thing you should know, who is juvenile? Juvenile is a person, whether male or female, whose age is less than 18 years, who has not completed the age of 18 years, maybe 17 years, 364 days. Once he crosses the 18th birthday, then he becomes adult. And if such juvenile commits a crime, those juveniles are known as juvenile offenders. Juvenile offenders are not tried in a regular court. They will be taken to Juvenile Justice Board, whereas maximum punishment given is only 3 years. But of course, now there is an amendment. If at all a person aged more than 16 and less than 18 commits a heinous crime means any crime for which imprisonment is 7 years or more, like rape, murder, then he will be taken to the regular court. Say for example, he will be taken to the session court. More than 3 years punishment can be given, but life imprisonment and death sentence should not be given if his age is 16 to 18. Remember that. Okay. So, here answer is 17 years. 17 years. A person died due to starvation. What is the true finding? What is starvation? Starvation means person is deprived of food or water or both. In case of starvation, person lose carbohydrate initially, then fat, then protein, and if a person does not take both food and water for about 10 days, around 10 days, maybe 10 to 12 days or 8 to 10 days, around 10 days, it is sufficient to cause death of a person. If a person takes only water and no food, he may die in about 6 to 8 weeks. So, person become weaker. All the organs shrink in size, but brain retains its weight, but brain does not get enlarged. Heart shrinks, stomach becomes small, but gallbladder get distended because liver secretes the bile, but bile will not be utilized. Okay, that's why. So, here the answer is distended gallbladder. Number 12, a child consumes iron tablets used by its mother. The antidote is iron, metal. What is antidote for metallic poisons? Chelating agent. What are chelating agents? There are chemical compounds which react with metal ions to form a stable water-soluble non-toxic complex. Okay. There are so many chelating agents like British anti-leucite, also known as dimercaprol or BAL, dimercaptosuccinic acid DMSA, dimercaptopropane succinate DMPS, ethylene diamine tetracetate EDTA or sometimes calcium sodium EDTA or calcium EDTA, deferoxamine or desferoxamine, all so many are there, penicillamine or cuprimine, so many are there, you may be knowing. But here what you have to remember, point number 1, out of all the chelating agents, if at all given a choice which is the best chelating agent, then better answer is DMSA, dimercaptosuccinic acid. It is also known as succimer because it is least nephrotoxic. Out of all, it is least nephrotoxic. Okay. At the same time, it can be given even in case of glucose 6-phosphate dehydrogenase deficiency. And it can also be given orally. It can be given only orally actually, DMSA. So, these 3 are especially useful against mercury, arsenic, lead. Or you remember for your exam, BAL for mal, BAL for mercury, arsenic, lead. See, listen to me, all these chelating agents can be given in many of the metallic poisons. Even EDTA can be given in case of lead. But you remember few things, BL is useful in treating poisoning due to all except BAL for mal, cadmium. BL is used as antidote in poisoning with, ask in PGI, BAL for mal, easy. A child consumes iron tablets used by its mother, the antidote is, all of you know it is very easy, deferoxamine or desferoxamine is an ideal antidote for iron poisoning. What is trientine? Trientine is given in case of Wilson's disease. Wilson's disease. Ball for mall. EDTA, it is also one of the beautiful chelating agent. It can also be given in so many metallic poison, especially in case of lead poisoning also you can give EDTA. But EDTA should not be given in case of chronic mercury poisoning. In mercury poisoning, EDTA is contraindicated. Mercury itself is nephrotoxic. EDTA is also again another nephrotoxic. Okay. Partial hanging may resemble strangulation by. It is not exact recall, nobody knows what is exact recall, but let me talk on this. In case of hanging, the ligature goes above the level of thyroid cartilage in more than 80% of cases. In approximately 80% of the cases, it is still above the level of thyroid cartilage. And when the fixed knot is used, as you see in the second picture, it does not completely encircle the neck. But if the slip knot is used, means the running nose, then the knot may come and touch the skin. It may be continuous, but otherwise it is not continuous when fixed knot is used. And usually it is oblique running upwards. Whereas in strangulation, it is usually seen below the level of the thyroid cartilage and usually transverse and completely encircle the neck, because person may put a rope or any ligature around the neck, tighten it. Okay. Now, partial hanging may resemble what is partial hanging? Partial hanging means some parts of the body touch the ground or any other parts on the objects on the ground. For example, imagine a person is hangs himself and he is in a kneeling position or he is just bent by the side. Now, the ligature, the course of the ligature may look horizontal. You understood? See, if the vertical, because the gravity body goes down, ligature will be usually oblique. But in case of partial hanging, imagine a person is sideways, the rope is here, then it looks somewhat transverse. Okay. Now, partial hanging may resemble strangulation by knot mark. No, many times in case of ligature strangulation, there will not be any knot mark. Situation below the thyroid cartilage. It is not necessarily that in case of partial hanging, situation should be below the level of thyroid cartilage. It can be above the level of thyroid cartilage, not necessarily that it should be below the level of thyroid cartilage. Dribbling of saliva is seen in some cases of hanging, but not in strangulation. But transverse ligature mark may be seen in hanging, partial hanging, as well as strangulation. So, best answer is transverse ligature. That is regarding recall questions of FMGE of this session. Wish all the best. Thank you.